Hey, you guys, welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before we get into our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. You guys, I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, courses, review books and videos to assist nurses as well as nurse practitioners with success on boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success, and I would love to work with you as well. Now, I always like to get into a disclaimer before getting started. Y'all know, I always say, remember there's no absolutes in medicines. And if I'm giving you questions, the questions that I have designed are based off of what they are currently testing on the ANCC as well as AAMP exam, okay? If I'm teaching or talking or giving y'all tips on anything as far as practice guidelines, I will always say that so there's no confusion as to what we're currently doing in practice and what's currently being tested because there's variances, right? As they continue to upgrade the test over the 3 to 5 year period, okay? So roll with me. I'm here to assist you. If you have topics, questions, or anything that you would like assistance with, to help you prepare for boards, to help you studying in school, or even just questions and things that you're doing in practice, just let me know so I can do videos to assist you, okay? All right, you guys, let's get into question number one for today. All right, question number one states a patient presented 72 hours ago in the office with otalgia and was diagnosed with acute otitis media. The patient was prescribed with amoxicillin but continues to have persistent symptoms. Based on these findings, how should the nurse practitioner treat? Is it A, explain to the patient to complete the amoxicillin? B, stop amoxicillin and treat with augmentin? C, prescribe ciprofloxacin? Or D, increase amoxicillin treatment duration? Take a moment and tell me what you got in the comments, you guys. Tell me what you got. Tell me what you got. All right, you guys, I always recommend reading the stem of the question first. I know you probably hear it all the time, but I'm saying this to you to help you. It allows you just to slow down so that you're not mixing things up, creating your own storyline, and missing questions that you do know the answer to, okay? That stem of the question just slows you down to ensure you're answering what is even being asked. So here, the stem of the question states, based on these findings, how should the nurse practitioner treat? And I say, if they're asking for treatment, we're going to run it back and figure out what the diagnosis is, what the assessment findings are, so that we can work through just as you would if someone was in front of you, right? So let's picture it because I think, not even I think, I know a lot of times we read questions, we're kind of like, what are they saying? And kind of working through. But visualize yourself here. You're in the office. You got your white coat on, you are doing your MP thing, right? Patient comes in. You just saw this patient 72 hours ago, a few days ago. You remember them. You're like, oh, they're back. They're calling back because you'll get the calls. Hey, they're calling back saying X, Y, and Z. That's the patient that had the acute otitis media, and we started them on amoxicillin, right? And so, what's going on? They're continuing to have those persistent symptoms. Nothing has changed, right? All right, especially with the pediatric patients, you guys, when they, if you start on amoxicillin and they continue to have persistent symptoms within 48 to 72 hours after the treatment has been initiated, you want to bump up to the augmentin dose. I always say, think of the A's when we're treating acute otitis media. Amoxicillin, first line, augmentin, second line. You can also use this first if if there's other criteria warranting to bump up. But I always say think of the A's for A for acute otitis media, first line amoxicillin, second line augmentin, and then azithromycin. Okay, but B is your best answer. We're going to stop that amoxicillin, tell that patient, hey, all right, let's stop the rest of that amoxicillin. I'm going to put you in a prescription for augmentin, which is a combination of what, you guys? Amoxicillin and clavulanic acid, right? And this is going to give them more coverage. And then, of course, you would bring them back in to assess and see if they are doing better. All right. All right. Question number two. A patient presents to the office with complaints of hearing loss to the right ear. He states that he works in a loud factory and has noticed that sounds are muffled on the right side lately. Upon examination with the Weber and Rhine test, the nurse practitioner notes AC is greater than BC, and on the Weber exam, the sound lateralized to the left ear. Based on these findings, how should the nurse practitioner diagnose? Is it A, otitis externa, B, a normal exam, C, conductive hearing loss, or D, sensory neural hearing loss? Take a moment and tell me what you got in the comments. Make sure y'all telling me what you have, okay? Tell me what you're thinking. This is going to help you to process it. If you need to pause before I go over it, pause the video, type in your answer choices, type out your thought process, and see how you do. Don't be shy. I'm here to help you because even that way I can talk and gauge you know where you are and help you with this so that you know you're retaining what we're talking about. So put in the comments what you think. All right, so stem of the question states, based on these findings, how should the nurse practitioner diagnose? All right, so we need to look and see what this assessment is, right? If we're diagnosing, we need to run back to our assessment findings and see what's going on. Subjective, objective, right? So what is the patient saying? What are they telling you when they come in the office? He's telling you he's having hearing loss to the right ear. He works in this loud factory and has noticed that the sounds are more muffled on the right side lately. All right, so we're trying to figure out what's going on. Like what's up? What's the problem? Why are you having hearing loss, right? So we're gonna do our Weber and Rhine. I say Rhine, y'all know I hear Rinne, Rinne, but the hearing test, Weber, Rhine. We're striking our tuning fork, we're assessing, we're going through the steps. So with the Ron exam, it came back as AC is greater than BC. All right, cool. That's a normal finding. That's what we want, right? Your air conduction should be greater than bone conduction by a 2-to-1 ratio, right? AC, air conduction, should be greater than BC, bone conduction, right? That's what we want. So okay, perfect. That's normal. Now, on the other hand, with the Weber exam, the sound is lateralizing to the left ear. Now, this is not normal, right? Because with the Weber exam, we don't want the sound to lateralize at all. They should be able to hear equally in both ears, right? When you strike that tuning fork, place it in the center of their forehead, you're asking them, do you hear the sound better in either ear or do you hear it equally, right? You want them to say that they heard it equally in both ears, just like AC being greater than BC is a normal finding on the Rhine exam. The normal for the Weber, we want you to hear the sound equally. So then if it lateralizes to one ear versus the other, that's letting us know a little bit more. We know there's some type of hearing loss going on. We need to figure out what, right? All right, so it lateralized to the left ear. So based on this should lead you to go to answer D, sensory neural hearing loss. Remember, when the sound lateralizes to the affected ear, so the ear that they're complaining of, the bad ear, that is conductive hearing loss, right? And conductive hearing loss is typically something is in the ear. There's cerumen, there's a kid has placed something in their ear or whatever that's blocking that sound conduction. It will lateralize to the ear they're complaining of, the affected ear. Whereas sensory neural, it will lateralize to the unaffected ear. So not even the one they're complaining of. And think about it. This is a sensory neurological issue that's causing this, okay? So the best answer here is D, sensory neural hearing loss, because again, the sound lateralized to the left ear where you know that the patient came in complaining about the right ear, okay? All right, you guys, and last question for the day. Question number 3 states the nurse practitioner and NP student are discussing a patient that presented to the office with fatigue, sore throat, and posterior lymphadenopathy. The NP student is inquiring about the virus this diagnosis is secondary to. What is an appropriate response by the nurse practitioner? Is it A, the Coxsackie virus, B, the Epstein-Barr virus, C, streptococcal virus, or D, idiopathic viral source? Take a moment and tell me what you got in the comments, you guys. All right, all right. Stem of the question states, what is an appropriate response by the nurse practitioner? So, all right, let's see what we're talking about. The nurse practitioner NP student have a patient in the office. They are there complaining of fatigue, sore throat, and they have posterior lymphadenopathy, right? So the NP student is inquiring about the virus that this is secondary to. So first you got to figure out what is this, right? So somebody that came to you with fatigue, sore throat, and posterior lymphadenopathy should give you the mindset that, hey, this is mono, right? Mononucleosis. Because one, that sore throat, that fatigue, we're starting to think strep throat, we're starting to think mono. But again, posterior lymphadenopathy is mono. So when we think mono, now that we have a differential diagnosis in our mind, now what? Now she's asking what virus is that diagnosis secondary to? And you should know that with mono, it's secondary to the B, Epstein-Barr virus, okay? So Epstein-Barr virus, your answer is B. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, and subscribe. It helps other nurses and nurse practitioners with the algorithm to be able to see these videos to assist them as well. And also be sure to share with whomever you may think may find this beneficial. If you need any additional assistance from the nursing studio, just let us know. We have review books. You can get the ebook option or the paperback option. Both links are in the bio, the description of this channel. The ebook, once purchased, you have instant access to that, and it is $39.99. And then the paperback will be shipped from Amazon. Okay, so with our review book, it is in color. It's broken down by system. It has interactive sections based on how I tell you guys assessment, diagnosis, evaluation, and treatment. And there's practice questions with rationales in the back. Same for the paperback. It's the exact same book. You just choose if you want ebook or if you want the paperback to take. But it is short and sweet in design for you just to do that review on the go style. Okay. We also offer review courses such as our self-paced review course that you can do anytime, and then our 5-week review course where we work together. We have weekly live sessions. We're currently in one. Our next one starts on June the 10th. And then our one-on-one sessions as well. One-on-one, you can choose to cover a weakness that you may have, or you can opt in doing our custom packages based on the timeline that you need to review and working on areas that you want to bring from being unsuccessful to successful on boards. Okay. So with any of these, or if you just simply don't know which route to take, just give us a call at the Nursing Studio, 803-400-6864. You can also shoot us a text to this number or email us at the nursing studio, the number 1 at gmail.com. Look forward to hearing from you guys. But as always, meet me back here. Happy studying. Bye, y'all.